Hi, my name's Jane Much. I'm lead consultant nurse here at the Hewitt Fertility Centre. Here at the centre we offer a wide range of fertility related investigations and treatments, and we are here to make your journey through the centre as pleasant and supported as possible. We have a number of consultancy rooms, scanning rooms and theatres, as well as one of the largest embryology labs in Europe, allowing us to treat thousands of patients every year with some of the highest success rates in the UK. As well as IVF, we offer a range of fertility treatments such as egg donation, surrogacy. We treat viral positive patients and those who wish to preserve their fertility, all of which we can utilise to ensure that whatever fertility concerns you may have, we can help. If you decide to start treatment with us, over the coming months you will be visiting us on a regular basis to undergo consultation, ovarian stimulation, embryo transfer and finally pregnancy test. During this time we will do everything we can to ensure your comfort with access to our counselling service, as well as mindfulness sessions, acupuncture and contact with our highly trained medical staff to answer any concerns that you may have. Our centre is open 7 days a week from 8 AM until 5 PM Monday to Friday, Saturday and Sunday by appointment only. If while undergoing treatment you have any concerns or questions, then please do not hesitate to give us a call or book an appointment to see one of our consultants, and we will do everything we can to help.
Hi, I'm Andrew Drakeley and I'm the Clinical Director at the Hewitt Fertility Centre based at the Liverpool Women's Hospital. For most couples, they'll have come through our workup at the infertility clinic at the Liverpool Women's Hospital, having been referred by their GP. And once the decision has been made to refer you for IVF, we'll complete a form and then bring it up to the Hewitt Fertility Centre. They will then send you out registration forms, which will be posted back, and then following this, you receive information of what to do next, plus the relevant consent forms. You're then booked for an IVF clinic appointment, where you'll see one of the doctors or the nurse practitioners, where more information will be gathered from you, and then the information about what happens next in terms of the IVF process will be explained. What we also need to do is screen you for HIV, hepatitis B and C within 3 months of having the treatment start. This is an HFEA requirement. Also, all the consent forms need to be completed and checked again before the treatment can start. After that, you will phone with a period, and then there are different ways of doing fertility treatment depending on what problem you have. So for a lot of patients, they'll be sent out drugs, and then those will be taught at a drug appointment with the nursing staff. A start date will be given for either injections or tablets, and this usually induces a second menstrual cycle. At this point, we scan you vaginally, looking specifically at the womb and ovaries. Then the medication, which is by injection form, which you'll have already received and be taught how to use, is begun. 5 or 6 days later, we'll often scan you again, and when the ovaries have started to respond, we'll add in sometimes different drugs which will stop your body releasing those eggs before we can capture them. On average, the duration of stimulation of injections is about 10 to 12 days. And at this point, we scan you again, looking for the number and the size of follicles on the ovaries. This usually equates to roughly the number of eggs that we might get. Advice will be given about this depending on what your own scan shows. From that, you're given a date and time for the egg collection, and a date and a time for the final injection which you have at home, and that's to mature the eggs. On the day of egg collection, you'll attend the unit early in the morning, and then an anaesthetist will give you sedation, which is injection given through the back of the hand to make you sleepy. It's not classed as a full general anaesthetic, but you're very sleepy and drowsy, and often you'll be in hospital for about 2 hours. For the actual egg collection procedure, the needle is placed through the back of the vagina into the ovary, and the fluid which will contain the eggs is then drained from the ovaries. On that day, you'll leave hospital knowing how many eggs you've got. At the same time, your partner needs to provide us with a sperm sample that will be used to fertilise the eggs. Depending on the quality of the sperm, there are 2 main techniques for fertilising eggs with sperm. IVF stands for in vitro fertilisation, and that's where an egg and a sperm are put together with 100,000 sperm in a dish and left overnight, and then nature will decide which sperm fertilises the egg. If there's a problem with sperm quality, you'll be recommended a procedure called ICSI, which stands for intracytoplasmic sperm injection. And that's where a scientist, called an embryologist, will select a single sperm to inject into the egg to try and make the embryo that way. The following day, you're phoned to tell you how many of the eggs are fertilised. Not all eggs will fertilise, on average about 60% will do so. Then those embryos are grown in the laboratory for 3 to 5 days, and a day 5 embryo is called a blastocyst. Along that time, the embryologist will be monitoring the growth and development of the embryos, looking for stages of development. Based on that, they'll be recommending the embryo transfer, which will usually take place on the 5th day after the egg collection. For the embryo transfer, we pass the speculum as if you're having a smear test, clean the neck of the womb, feed a fine tube into the womb through the cervix and inject the embryo. That usually takes about 10 minutes to do and doesn't require any anaesthetic. After this, you'll have already been started on vaginal progesterone pessaries that help support the pregnancy in the first 2 weeks. Roughly 12 days after the embryo transfer of a day 5 blastocyst, we'll ask you to do a pregnancy test. Hopefully it will be positive, in which case you're pregnant, and we'll book you for an ultrasound scan 3 weeks later to make sure that the embryos are growing inside you. Unfortunately, sometimes this is not successful, in which case you'll have the opportunity to see the clinical staff in clinic and also counsellors for support should that be required. I think in preparation for becoming parents, a healthy lifestyle is important. This means cutting things out that may well be well documented to be harmful for pregnancy, certainly smoking, drinking excessively. Obtaining a good weight, and normally body mass index between 20 and 30, is encouraged and is actually mandated by the NHS to be eligible for treatment. The rest of it is just sensible things. Folic acid, 400 micrograms for a woman, and general multivitamins for the man and the woman. Roughly 2 weeks after the embryo transfer, we'll be doing a pregnancy test, and if it's positive, you're pregnant, and if it's negative, then it's not likely that you are. The Hewitt Fertility Centre is one of the largest NHS providers of fertility treatment and IVF in the UK, treating roughly 2,000 patients in Liverpool and 500 a year in Knutsford. So as a combined group, we're one of the biggest. Also, we offer a full gamut of services from IVF, ICSI, egg donation, sperm donation, and so on, and since 2013, surrogacy also. We're also the regional centre that treats patients who've got cancer, who are about to have their fertility harmed by either surgery or chemo or radiotherapy. Similarly, we're one of a few units in the country who can treat patients who have transmissible viruses such as HIV, hepatitis B and C. From a pregnancy rate viewpoint, we have a respectable 50% pregnancy rate for the under 35s. If unfortunately you don't get pregnant on the first attempt, you'll be offered a clinic appointment with a doctor or nurse to discuss what happens next. If we do have frozen embryos in storage, then they will be used first. If a woman has a regular menstrual cycle and knows that they ovulate, we'll do a natural frozen embryo transfer. That means no injections or tablets or needles. If, however, a woman has a more chaotic menstrual cycle or doesn't ovulate, we need to chemically manufacture a menstrual cycle so all the hormones fall in sync for frozen embryo transfer. This does involve tablets and injections. If you have more NHS funding entitlement to you, then we can talk about second or even third cycles. However, if the NHS entitlement has been exhausted, other options such as self-funding the treatment can be discussed. In terms of what they might be, that will depend on your own situation, how many eggs we got, how many embryos we got, what they did, what the sperm quality is like and so on. So each of that needs to be tailored to the individual couple.
Hi, my name is Sally Wood. I'm the clinical nurse manager here at the Hewitt Fertility Centre at Knutsford. So appointments here for patients on their first visit is to get a bit of a medical history for both the male and the female, or both female if it's a same-sex couple, because we do treat same-sex couples and single women here with us. We like to get a bit of an overview of your general health to make sure there's no issues that may affect us further down the line, but also get a bit of a history regarding your treatment in terms of fertility, if you've had any treatment previously. And we then arrange some baseline investigations such as blood tests, weight checks and ultrasound scan, and where the male is present, also a semen analysis. So at Knutsford we offer a lot of procedures. Again, we're similar to Liverpool, so we can do IUI treatments, donor IUI treatments, IVF and ICSI. And we also see patients that require surrogacy treatment and also fertility preservation to cater for all needs of all patients. Yes, the process obviously involves many medications. Ovarian hyperstimulation tends to be something most patients can focus on, and it's where the ovaries can overstimulate the medications that we give to them, and can cause them to become uncomfortable, discomfort, some abdominal swelling. But all the time that you're coming through to us, we are monitoring you, ensuring that your safety is of paramount to us. And if needs be, we can reduce doses of medication, we can freeze embryos before putting them back. Like I say, your safety is always our main priority. In terms of egg collection, it's quite an invasive procedure. It requires ultrasound guidance and the use of a needle. You are sedated for this procedure to try and minimise the discomfort for you. We give pain relief intraoperatively, and we can also give pain relief afterwards. But once the eggs have been collected, your ovaries are starting to return to normal, things should start to settle down quite quickly. But obviously there's always that patient that needs a little bit more attention because they're overstimulated quite a lot. So here at the Hewitt Fertility Centre at Knutsford, we can offer all our patients, be it NHS or private, the use of embryo glue and time-lapse imaging. That comes as standard with all of your treatment. We used to offer it as a pay-as-you-go basis, but we realised actually it did improve the success for patients and their outcome. So the trust invested into those technologies to improve your success rates, but also used alongside scan machines, up-to-date technologies, and the expert advice of the consultant or the fertility nurse specialist here on site. We aim to provide an individualised care for each patient to improve your success rates. So there'll be various appointments for each patient, and it will depend on your individual care as to how many appointments you will need. But on average, from first consultation through to embryo transfer, most patients will only need around about 6 appointments. That's including your first appointments, your drug appointments, and various scans that you may need. But obviously each patient as an individual may need a few more, but that will be discussed with you at your visits. So side effects, as with any medications that we can take, can be quite extensive, but the main ones that we ask you to look out for is ovarian hyperstimulation. So as your ovaries are starting to respond to the stimulation medications, what happens is we're trying to grow as many follicles as you've got on your ovaries, as opposed to one that becomes dominant each month. So excessive bloatedness, diarrhea and vomiting, breathlessness, and pain that paracetamol doesn't take away are all key factors to look out for. We ask you to drink roughly 2 to 3 litres of water a day. That will help to minimise the ovarian hyperstimulation risks, but it doesn't completely eliminate them. So once you start your treatment, you will be given a treatment booklet, and on page 13 of that booklet is the specific information to look out for with ovarian hyperstimulation. What we suggest with all our patients is, even if you think it's nothing that you're feeling, we'd rather you ring us and have a chat to one of the nurses to discuss your symptoms than sit at home worrying about it and then become unwell. So whilst we're part of an NHS trust, we also offer self-funded treatment for our patients. You are able to either fund that treatment yourself, or we have a new package available to patients through a company called Access Fertility. So if you're looking at wanting to fund treatment but would like a little help with that, then please speak to one of the nurses and they'll be able to give you the contact details for Access Fertility. That will require a questionnaire that both yourself and the treating centre need to fill in, be it here at Knutsford or over at Liverpool. And then once they've got that information, they will then make the decision as to what finance packages they can offer to you.
Hi, my name's Becky. I'm one of the embryologists and I work at the Hewitt Fertility Centre in Knutsford. Currently we're standing in the embryology lab, and behind me you can see the embryoscopes, our incubators that we use to culture our embryos in. An embryologist works in the lab day to day, and we do egg collections, sperm preparations for IVF and ICSI treatments. We thaw frozen embryos for patients to have them replaced in frozen embryo cycles. We also grade and select embryos for fresh embryo transfers and freeze any suitable embryos as well. So a blastocyst is the stage of embryo development that we would expect to see on day 5, following normal development patterns. You can see one on the screen behind me here. It's what we'd like to see, and at the blastocyst stage we can see 2 distinct cell lines. We can see the cell line that may go on to form the baby, and we can also see the cell line that may go on to form the placenta as well. Okay, so these machines behind me are the embryoscopes. So these are the incubators that we store the embryos in while they're with us in the lab. These incubators are very specialised as they contain cameras. What that does is it takes a photograph of every embryo within the incubator every 10 minutes, giving us effectively a video of the embryos while they're with us. What this means is that we don't only get a snapshot view of the embryos when we come to look at them, we also get to see them when we've been at home, when we've been asleep. When we come back in the morning, we can see exactly what they've been up to overnight, and we can get a really good idea of exactly which embryo is the best embryo to give a patient the best chance of achieving a pregnancy. The great thing about the Hewitt Fertility Centre at Liverpool and Knutsford is we have 100% time lapse. What that means is that every patient who comes to us has their embryos placed in an incubator like these ones behind me, like the embryoscopes, that take these photographs of the embryos and give us those videos. So we have all that information for every embryo that's with us.
Hello, my name's John Lippett. I'm one of the counsellors at the Hewitt Fertility Centre in Liverpool. So counselling is available to you before, during and after treatment. We have a small team of counsellors and we're here for you throughout the patient journey. Some people just see us once, twice. Some people see us regularly throughout the process. Some people only come to see us after their treatment cycle. We're as flexible as we can be, and we accommodate you at any point during the treatment journey. Yeah, counselling is available to single people, couples. Some people come together, some people come separately and then maybe bring their partner to a second session. Some people come as a couple and then perhaps decide they'd like to see individual counsellors, and we can accommodate that as well. So we try and be as flexible as we can and work with what works for you. So yes, counselling is available to both single people and couples together. Counselling can be really helpful. It's not for everyone. It's certainly not compulsory, and we don't expect everybody to receive counselling, but some people find it can be really helpful just to kind of help them through the process. So, as I said before, some people come right at the beginning of their journey because they're a little bit anxious about what's to come. Some people come in the middle of a treatment cycle because they might be finding it difficult to manage. Some people come at the end of a treatment cycle, particularly if it's not been successful, and they want to talk that through and then think about what they're going to do next. So I wouldn't say it was necessary for everybody, but I'd say it can be really helpful. And I wouldn't want people to feel that it's going to inhibit their progress through treatment. So sometimes people say to us, oh, we're worried if we see a counsellor that you'll make a judgment and you'll stop us going ahead. It's not about that. We're here to try and help you through the process and make it easier for you. So I wouldn't want people to be put off coming to counselling out of fear that we would kind of make a judgment. That's not what we're here for. We're here to try and support you through the process. Counselling sessions are generally an hour long. How many you have really is up to you. If you're an NHS patient, you have as many counselling sessions as you and we feel is necessary. Some people, as I said before, just have 1 or 2 sessions. Some people come quite regularly. We don't tend to say, okay, we'll see you 6 times once a week for 6 weeks, because most people don't want to work that way. So we might see somebody once, then we don't see them for a month or so, and they pop up again and we see them for another couple of sessions, depending on what's going on for them. Counselling can be really spread out. I've had people who I've seen at one point in their journey, and then maybe a year later they'll come back to me and say, look, things have not worked out so well for us, can we see you again? We'll see you even for a few more sessions. So again, we really try and be flexible. The waiting time for counselling is as short as we can make it, but there is a waiting list, so you can't be seen instantly, but generally speaking we see you within 2 or 3 weeks of your referral to us. You can refer yourself into us, you don't have to come through anybody else, you can just phone straight through to the counsellor's office and make an appointment with us, or you can be referred in by one of the other clinic members. So people come to us for a variety of reasons, but I guess having a fertility problem of any kind can cause all sorts of mixed up, difficult feelings for the people who are going through that. So sometimes people find that they're really having trouble coping with being around pregnant people, people with small babies, really mixed feelings. Having a fertility issue can bring up feelings in you that you're really unhappy about having. So for instance, a friend tells you that they're pregnant and there's a part of your brain saying, oh, I should be really happy about that. And there's another part of your brain saying, I hate you, why have you done this? How can you be telling me this? It's awful. And you get these real mixed messages going on. So just working through some of that, some of those feelings that come up when you're struggling to have children and you see people all around you seeming to get pregnant without a problem, that kind of thing can be something that we could work through in counselling. Sometimes there's issues in relationships. If you're going through this with a partner, it may be that one of you is really keen on finding out loads of information about the process and want to know more and more and more, and the other person doesn't want to know very much at all, and that can get difficult when you start to misinterpret what's going on for the other person. Well, don't you care? Do you not want to know about this? Do you not want a baby? And the other person, well, why do you need to know so much? Let's just deal with it as we go along. And of course, sometimes we're having to deal with the aftermath of unsuccessful treatment, so sometimes people want to come and talk through that. What happens if you have a whole cycle of treatment and it doesn't work out? Where do you go from there? So they're just examples of some of the things that people might come and talk to us about. We do ask if you're having anything donated to you as part of your treatment, donor sperm, donor eggs, donor embryos, we ask you to come and see one of the counsellors first before you go ahead with that. It's just to discuss the implications of it, to be sure that we've explained the implications of that process to you so that you understand what it means for you, what it means for any children born as a result. It's not a test. We're not there to decide whether you have treatment or not. We're just there to make sure there's no shocks and surprises further on. We don't want you to go into the treatment process and then say, oh, hang on, nobody mentioned this, or I didn't realise that could happen. So we look at various future scenarios, things that might arise as a result of using a donor, and just be sure that you're ready to do that and you're going into it with your eyes open.
Thank you, and the very best of luck with your treatment.